Chapter 4 Measurement Settings. You are now in the Measurement Settings menu. You see the name of the patient, his or her date of birth, and the reference group he or she is linked to on top of the screen. At Instrument Location, you have to indicate whether the measurement is done vaginally or anally for women. For men, this is automatically anally. Secondly, you have to select the type of diagnose or which type of training or therapy you want to perform. You could choose between rest, MVC, or endurance. Rest measurement, you ask your patient to feel the pelvic floor while in rest and doing no activity. Rest is to assess the rest tonus of the pelvic floor. It can also be used as a free program. Please make sure that you save only actual rest tonus in order to not pollute your data. MVC stands for Maximum Voluntary Contraction. In this program, you ask your patient to do repetitive, fast twitch or coordinated maximal contractions and relaxations of the pelvic floor muscles. The endurance program is the slow twitch. Here you ask your patient to contract and hold the pelvic floor muscles for the set of time. If you want to compare your patients with the healthy baseline of their reference group, please turn on the button. This allows you to view the circular grid in color, red, white, blue. However, it is advised to start without comparing with the reference. The circular grid will be in an absolute grayscale. Measurement duration. Here you can select how long you want to do the program. Please note that you can always stop and save the measurement earlier. For MVC, you can enter the number of contractions, contraction active period, and the rest period between contractions. The same for endurance. You can enter steps of 1 second. Please note that the minimum contraction active period for endurance is 15 seconds. Display settings. During measurement, you will see the circular grid as well as the line graph. Here you can set how you want the line graph to be displayed. The EMG sensitivity can be set in steps of 5 microvolt. The EMG time span can be set in steps of 5 seconds. This is also a kind of scale setting for the line graph. Besides diagnosis, the programs REST, MVC and endurance can be used as a training program and myofeedback. 2 EMG reference lines can be chosen to serve as a threshold for the patient. You could use a minimum and a maximum for training purposes. When the value is 0, the lines will not be displayed. Frequently used settings can be set as default. Per diagnose type, REST, MVC and endurance, a default setting can be saved. The default applies for all patients. Personalized default settings can be easily changed back to factory settings when the Restore Default button is selected. The maple grid is showing you the pelvic floor like a tunnel. You see the 4 sides, top, left, bottom and right, and 6 depths. The most outer ring of the grid is most superficial, going more into the circle of the grid, the deeper into the pelvic floor. The 24 points correspond with the 24 electrodes of the maple probe. All 24 electrodes are active per default and marked green. It is possible to only include a certain part of the pelvic floor in the measurement. Individual electrodes can be selected or deselected when pressing each individual electrode. Per side, the electrodes can be selected or deselected when pressing buttons top, left, right or bottom. The minimum number of selected electrodes is 2. To get a complete and full understanding of the condition of the pelvic floor muscles of the patient, we advise to start with all electrodes selected. After you have set up your preferences, you can proceed to measurements by pressing the measure button on the top right.